Well, thank you. That was great. I appreciate it.
No, thank you. This has actually changed my life.
Hey, everybody. We got Dave here. Dave is a patient of mine that came in, 6 months ago.
Something like that.
So we wanted to go over his wonderful journey. Why don't you start by telling us kind of where you were before coming in and seeing us? What led you up to? What was life like? What your problem was?
Okay. Well, I've always been an athlete. Not a good one, but I've always been active. So I was playing football in the 1980s and I snapped my ACL in my right knee and got it repaired at that time. And then played 15 years of basketball with a bunch of friends every week and like 3 hours a week, heavy basketball. And it started getting worse and worse. So after a while, with age and everything else, you end up in some pain. So I started realizing the pain about 4 years ago, 5 years ago. And I know a little bit about the anatomy, not a lot, but it felt to me like my meniscus was starting to wear down, and it felt like it was bone on bone, especially on the medial side. It felt like not when I walked all the time, but when I walked extensively, maybe a quarter mile, say, or something like that. Then it started to swell a little bit, and I started feeling bone on bone. I just couldn't walk anymore. So I decided, well, I'm going to get a new knee, the new prosthetic. So I looked into that, and my son, who you know, he said, "You're not going underneath the knife. You're just not going to do it. I'm not going to let you." And so he he knew about Dr. Whitney, and he says, "Go in and at least see this guy, see what it's going to be like." And so that's when you and I met. And you started saying, "Well, you know, it, I don't know how much it's going to help you, but typically it's right around 80% or so." And I said, 80%, I'm on it.
Italy, have you said 80% good?
Yeah. And so I said, that would be all I really need is about 80%. I just want to get away from the pain, be able to walk.
And avoid a major surgery. Like
Avoid the
put it off as long as you can if you ever need it.
What happened is that, and my son was saddened by this, but my father went into a routine surgery when he was 86 and never came out. And my son was really close with my father. So my son said, "You're not going underneath the knife." Yeah. So that's when we started talking. And I said, "You know what? I'm going to give it. It's not that much money. I'm going to give this a try because I could always get a new knee
Right.
5, 10 years from now." So we came in and you gave me the first injection, and it wasn't, it was a little sore for a couple days walking, but then after a while, I was back to normal. And then after, what was it, 2 months?
Yeah, it was supposed to be 4 to 6 weeks. We're gonna do the second
Right.
transplant, no second application, but then it'll be about 2 months.
Yeah, about 2 months later, I realized that I'm not even thinking about my knee. I'm walking around and I forget that I even have a bad knee. So I called Dr. Whitney and I said, "God, it's more than 80%. I still have a little bit of pain. I've got old parts, so I still have a little bit of pain in my medial and lateral ligaments, but there is no more bone on bone. There is no more swelling. And I told him, "Geez, this is really nice." And he said, "It's got to be like at least 80%. And he said, "Wait, you're supposed to be coming in for another rejection." And I didn't know.
Because you were like, this is got it. Happy doing it.
And he go, well, you have one.
And I said, don't worry, quick. I haven't done the second one yet.
Yeah. And I went, all right. So I went in for the other injection about a month and a half ago.
Mm-hmm.
Right?
Yep. Yeah. Because you've been gone. You traveled for about a little over 2 weeks.
Right.
And then, yeah. So.
And so I went in specifically before my trip to Greece because I knew that we were going to be doing a lot of walking. So I went in about 4 months before my trip to Greece. And in Greece, you do a lot of walking. I love the stairs, thousands of stairs. So then and we were in a hotel that was built on the side of a mountain in Greece, in Santorini, and you have to go upstairs and downstairs everywhere. So I started going up and down these stairs, and I was a little, especially my medial and lateral ligaments,
Which we haven't worked on yet.
which we haven't worked yet.
Yeah.
So there was a little bit of pain there going up and down the stairs, but we were there for about 10, 11 days. And after about the 5th day, it just went away. And I realized, a lot of this pain is from not working out enough. And so I said, I'm good. I'm not, it's not a brand new knee because of the old parts and everything around it, but I would say I'm 90%, more than 90%.
Yeah. We haven't even tuned up the old parts yet.
Yeah, so put it up in the old parts.
parts.
You got to take out your automobile manual. And
So after the first time coming in, what was your progression like that first month or 2 months? Sore for a couple of days.
yeah, I would have to say that it was the same and a gradient, right? It was the same for a while, that all of a sudden I forgot about it. And I realized I had to snap back and say, wait a minute, you got a bad knee, but I don't have any pain. And so, I've got a job that, there's some walking and stuff like that. And so I'm doing all this walking in construction and looking at things. And all of a sudden I'm realizing, if this was 6 months ago, I wouldn't be able to do this. And I just said, Dr. Whitney, if you want me to show up and do a video, I'm all in, because I'm happy. So very, very happy.
And in case anybody's confused, because we haven't talked about what we really did to your knee, you might have came to this video Googling for stem cells or something, but we did a stem cell transplant. Do you remember your dose?
The dose?
I don't remember your dose.
You're asking.
That's what we did, a stem cell transplant. And I think we did like 100 million. Umbilical cord live stem cells derived from an umbilical cord. Put that in your knee.
Mm-hmm.
So that's what we did, in case you're wondering, well, this guy got a steroid injection and whoop-de-doo, you don't have any pain after your steroid injection. That's not what we did. So we did that. We did the transplant. How do you gauge how well you were doing between the first and second month? Tell us about disco night.
Oh. Well, there was a disco night in Scottsdale that my wife wanted to go to. So we went to disco night, and it's a completely packed. So there's no chairs, no tables, no nothing. So you got to stand around for what amounted to 3-4 hours. And I just realized by the end of the night, I'd been standing on my knee for hours and dancing disco with my wife and our friends. And I didn't even realize that I've got a bad knee. Yeah, you got a bad knee. And I go, oh, I didn't know that, because there's no pain. So disco night was a success.
And I tend to tell that a lot. I think you're a little faster than average, the average patient, with your healing time, your healing response, being able to do disco night that soon. But that's what I try to tell them. It's about a month is when you should kind of start noticing at least a trend of it starting to improve. And ideally, that's what happens. I just forget about it. You forget, you're just out and doing stuff, and you're like, oh my gosh, it's right. That's kind of the best patient response.
Where is my bone on bone pain?
Yeah.
I don't feel it. And I should be feeling it because I'm disco dancing.
Because it's hard to think that way when you have it.
When you have it, it consumes every step. It
Every
consumes every walking minute. And after I got the injection, I'm just talking about me and my experience. It was just night and day. I'm waiting for the bone on bone feeling because I could feel it. I could feel the abrasion in my knee going back and forth, and my knee was loose. I felt as though the knee, the tibia, and the femur were loose inside of the capsule. And all of a sudden, after a while, it felt like it was full and it wasn't bouncing. I felt that there was some looseness before the injection. And then after a while, and when I walked a lot, it would swell. Then it would really hurt. And all that's gone now.
Yeah.
Yeah. 90% is gone.
90%. Yeah. And that's usually a talk I end up having, because everyone that hasn't gone through this journey yet is very curious. Like, what about this? What happens with this? When is it going to stop hurting? And if it does stop, how long does it last? It's a hard question to answer because it depends on how healthy a person is, what their lifestyle is. But you recover a lot faster. Do you not? Like, if you do have pain, do you feel like, if you walked that far or did a disco night, you'd be out for 2 days or something, right?
You wouldn't be able to wake up the next morning.
Eh.
Yeah. Yeah. But
So we're not eliminating pain. We're speeding up the recovery.
don't want to say that it's 100%.
Right.
I'm just saying that I forget about it. I just forget about the fact that I've got a bad knee and I don't feel any pain when I'm walking extensively. When you've been to Europe, there's not a lot of biking or anything like that. It's just walking, a lot of steps. And I wouldn't have been able to do it.
Yeah.
If it wasn't for the injection.
Yep.
Without a lot of pain.
Yeah, without trying to take your ibuprofen or take your Tylenol or whatever, and see how far I can manage.
Well, see that we went to Europe 2 years ago, and I got the injections. I knew I wasn't going to be able to do it. So
You did steroids before.
steroid before, and it was painful, but it wasn't that bad. And so I was going to do it again this year. And then I met you, and we did the injection, and I didn't do any cortisone, no steroid. So it was.
How do they compare? I've thrown myself in the deep end. You can answer honestly, because I haven't asked you this yet. Because I didn't know you did the steroids and then went to Europe. Steroids and then Europe versus stem cells and then Europe. Which one was better?
I don't know. I think. Well, this time I did a lot more walking this time. And I remember walking that before. We were just talking before we came here about my Positano trip. And I was walking down the street and I said, I'm done. I'm not walking in.
Didn't want to go down. All
That's
that.
right. I'm not going to go down all the way to the beach club. And I remember that I was done with walking.
Yeah.
And I didn't do that this time.
Yeah. Good.
So yeah, it had to be the injection.
And to get a new knee, I think is plausible. We've only done you're two injections in. I think it's theoretically possible.
Maybe 3.
It's been like 3 months. Yeah. So I think, we're talking a new knee here, right? Like in somebody that's 50 years old.
Yeah, thank you very much. Since I was, 45 when I got married. But tell me, with your 5-year-old son.
With your birthdays, Yeah, it's gonna be it's impossible, right? It's almost impossible. But I don't think it is. I think you in the future we're really close to like having a new organic knee.
Yeah. And again, I think that um, it would be better if I had an artificial knee potentially going up downstairs. But I've got the risk of a knife, and I didn't want that risk, and my son didn't want that risk for me, and I'm 90% there without having to go through the risk and the expense and
Yeah.
the recovery of a brand new knee.
Mm-hmm. Which can work out great. I think a lot of people in my industry tend to default to shaming surgery. Like, oh no, it's horrible. Don't go do it. I am objective, super objective in myself, in the business. Um, and I don't say that. I think surgery it can be great. I've met so many people that had great surgeries, but they just want the other knee, hip, whatever done because they don't want the recovery. But the surgery after did great. But one of the big risks is you do go under the knife, you do go straight, and it goes bad. What happens?
Right. And
There's not.
I used to when I was young and just graduated, I got a fellowship in medicine. So I've seen surgeries. I've seen a lot of surgeries and they can go bad.
Yeah.
And I just didn't want that. And my father dying from going into a elective surgery and never coming out, I just didn't want the risk if there's a possibility because I thought I can take this knee, take the injection. If I'm still in pain and stuff like that, I could always get another knee.
Yeah,
Right? I
yeah.
always have surgery.
Default to doing surgery. Yeah.
I don't have any interest in doing that right now.
How easy was the injections?
I'm a baby. I told you that when you were doing it. I'm a baby. So I was expecting pain. I can't deny that the injection of the anesthetic what stung like a bee sting.
Yeah, yeah. It's sometimes even worse than the whole. I'm trying to help the patient up. It's sometimes worse than
Yeah,
doing the whole thing.
right. Yeah. After you put in the anesthesia, I was fine.
Yeah. Okay.
I was fine. Anesthetic?
Anesthetic. Yeah. I think a lot of people get worried about that. Like, oh, how do you put me under for this? Like, am I gonna feel the whole thing? And everyone's a little different. Guys tend to be bigger babies than women.
Yeah.
They do. We do. We just do during
You
procedures.
should to be a bigger baby than most guys.
You were very apprehensive. The first one. The second one, you weren't. I don't tell.
No, the second one was like, bring it on, I don't care.
Yeah.
But
I think you fell asleep.
I remember my surgery on my ACL, and that was miserable recovering. I had days where I just sat there, couldn't sleep at night, and this thing was just boom, 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 and I knew that I was going to go through that if I got a artificial knee, and I wasn't looking forward to that. This was like a walk in the park compared to that. And we haven't really done any type of knee strengthening or anything like that yet. And I just felt like it's fine. I just feel like I don't need it. That's my story.
Oh, yeah, I love it. Thank you so much for sharing it.
Yeah. And I kind of wanted to share it because I was so happy with the results. Again, I don't know if my results are going to be anywhere near anybody else's. I don't know. I'm not in the business, but it was great for me.
It does vary a lot. I'm actually a very, very fast responder. So the times I've had injections, it's borderline miraculous. Talking about for like within a week, just completely almost out of pain.
Yeah.
And other people it takes them a month or two. Yeah, we don't know why. We don't know why. Some people just seem to respond really fast. You seem to be really on the faster side than average, I'd say. But it can be a
I don't really think I had any post-injection pain after a few days.
Mm-hmm.
I felt like the knee was normal, painful to walk and stuff like that a few days later, but not from the injection, just because your stuff hasn't started working yet. And all of a sudden, after about a week, I'm feeling a lot better. And after 3 weeks, I'm not even registering that I've got a bad knee.
Yeah.
That's what I experienced.
I think that in my experience in regenerative medicine as a whole is a big difference between using a live stem cell transplant, which is what we did. We showed you the cells, I think, Eric. So using those live stem cells versus a biological product, which is something you buy from a commercial lab that they make in a little controlled lab, and then the salesmen sell it to the doctors and stuff like that. And that I think has given the overall industry more of a, well, you probably won't see results for like 3 months or so. And for me, I'm like, I've usually wondered maybe even 2 months, like you should be tap dancing away. Some people
Disco
dancing away. But so, yeah, I think it's the bone marrow versus adipose, versus these umbilical cord cells has another different prognosis or another different outcomes, but they all tend to get lumped together with stem cells. So I heard people, oh, I did stem cells, they didn't work. Well, what did you use? Like, did you use bone marrow that they took from your 50-year-old hip, or 60 or 70 or 8-year-old hip? So people need to know that when we say stem cell medicine, it's not all stem cells aren't created the same. Is it a biological product? Is it umbilical cord? Is it stem cells taken from a fat or bone marrow? All those really have different outcomes for the most part.
Yeah. So just so I understand, you took blood, you spun it, you took my own cells.
That was your platelet-rich plasma.
Oh, platelet-rich.
That was the PRP that we mixed the stem cells with.
Okay.
The stem cells came from a donated umbilical cord. So yeah, we take your blood to get what we call PRP. That gets mixed in. Or how we do it. I like to just mix it in with the cells. Some doctors do it differently. They like to do it before or even maybe after the stem cell injection. But yeah, that's why we took your blood. Just to mix in with the stem cells and inject that. Kind of makes a little matrix for the stem cells to bind onto.
Got it.
Yeah. So that's Dave's story. Few hundred, maybe 50, 100 million stem cells, 90% new knee, disco dancing in Greece, traveling the world.
Had to.
Yeah. Well, thanks, Dave. Everybody else, subscribe to our channel if you want to hear more fascinating stories like Dave, and we'll see you in the next video.